Bismillahirrahmanirrahim. So another very important page, just continuation of clotting factors and clotting cascade. Here we'll discuss mechanism of some drugs and certain clotting factors which are depleted when we use those drugs. So we know that most of the clotting factors are synthesized in liver except factor H and factor 4. These are MCQs, and the important factors which are activated inside liver by vitamin K are 2, 7, 9, 10. Protein C and protein S. Protein C and protein S are basically anticoagulants. So if they ask about clotting factor, they are 2, 7, 9, 10. If they ask about which coagulation factors, which coagulation factors are activated inside liver by vitamin K or synthesized, in fact both are right words, but activation is more is better. These are 2, 7, 9, 10, and protein C and protein S. So protein C and protein S, the anticoagulant, they have the shortest half life. So if we give some drug like warfarin, which has anti vitamin K activity, it will not let them to be activated. So protein C and protein S are first consumed, then other factors, and this will be asked in MCQ, that first to deplete in vitamin K deficiency, or in other case use of warfarin. So both can be asked. It is protein C and then protein S and then factor 7. So factor 7 amongst all factor has shortest half life if they ask about clotting factors, not protein C or S. So it's factor 7, and 2 has the longest, that is prothrombin, longest half life. 2, 7, 9, 10, protein C, protein S. First MCQ, vitamin K mechanism, gamma glutamyl carboxylase activation. It is another MCQ. Warfarin exon vitamin K is another MCQ, and we give fresh frozen plasma or PCC for reversal of warfarin toxicity immediately, because vitamin K, if given, will take some time. So it the antidote is vitamin K if specifically asked, but for immediate reversal we use FFP mostly in clinics. So we move on to the other MCQs down here. The anticoagulation cascade is mostly done by antithrombin protein. So antithrombin is against thrombin, the against factor 2, that inhibits thrombin, and it also inhibits many other factors like 7, 9, 10, 11, 12. So we know 12 is the most important for intrinsic pathway. So antithrombin inactivates or inhibits thrombin, as name suggests, but it also inhibits factor 12, factor 10, and these are mostly the intrinsic pathway factors. So heparin mechanism is asked. It enhances the activity of antithrombin 3. It indirectly inhibits factor 10, factor 12, but it enhances the activity of antithrombin 3. That is the first mechanism if asked in MCQ. Heparin enhances the activity of antithrombin 3. Principal target of antithrombin is thrombin and factor 10, and also factor 12, and factor 12 is of intrinsic pathway. So we know that heparin acts on intrinsic pathway, and APTT is raised on in intrinsic pathway. So for heparin we monitor APTT, and for warfarin we monitor PT. That is or PT is also monitored for liver function. That is the most important marker of liver function, and most of the factors inside liver are dependent, are decreased, and PT is increased. So that's why warfarin, PT, extrinsic pathway, because of the factor 7 that is involved in extrinsic pathway, uh, are summarized in upper portion, and extrinsic pathway or heparin related mechanism is in the lower portion. And mechanism of protein C, that it activated protein C cleaves factor 5 and factor 8, that it can activate certain factors 5 and 8. And if factor 5 is resistant to protein C, it is not inactivated. Normally in body there is a balance between activation and inactivation, and it is not inactivated, resistant. That will lead to factor 5 leading mutation. It is a prothrombotic state and is the most common genetic cause of prothrombotic state as well. And most common cause of bleeding, it would be a von Willebrand, that is an opposite bleeding. Von Willebrand, that is autosomal dominant, and here factor 5 lesion mutation is opposite of it, because it involves the anticoagulant, not the procoagulant. And so we move on here. Some important points, these should be added down this page, and it is related to the last page as well. About factor 12 or Hickman factor, MCQs are only factor deficiency of which causes coagulation rather than bleeding, because factor 12 has certain other mechanisms not shown in previous page or any book, but it is written in Robin as well, that it is the only factor, only clotting factor whose deficiency causes, because of certain other mechanisms, causes bleeding. Specifically factor 12 deficiency causes coagulation rather than bleeding. So it is basically pro coagulant in certain mechanisms. So it's not the factor 7 if asked, it is the factor 12. Factor 7 is famous for shortest half-life and in extrinsic pathway. Factor 12 activates clotting as well as kinin system, we know. So here it links the two mechanisms, bradykinin production mechanism and start of intrinsic cascade. And in endothelial injury, factor 12 is activated first of all, that is intrinsic pathway activation. And about factor 13, it is fibrin stabilizing factor, we already have covered it in previous page. Role of factor 13 is to stabilize fibrin, given in previous page. And factor decreases during pregnancy is antithrombin 3. So antithrombin 3 is decreased in pregnancy, so there will be less thrombin that is inactivated, more thrombin will be present. So pregnancy is a procoagulant state because of decrease antithrombin 3, just like the what heparin does in normal mechanism, that it enhances the antithrombin activity. In pregnancy it decreases the antithrombin activity. Two are opposite thing. Heparin thins blood, so pregnancy causes procoagulant state opposite to it. So these are the very important MCQ from this page. Warfarin, heparin mechanism, uh, factors. For warfarin it is PT, for heparin it is APTT, and mechanism of antithrombin 3 and certain important factors like 12 and 13 and their MCQs from this page. And this depletion of factors, that is the vitamin K dependent factor is protein C, protein S, and then factor 7. And if specifically asked about clotting factor, then factor 7 should be preferred because there are anticoagulants. Thank you.